guys, welcome back to Bariatric Beauty and Finishing School. My name is Kelsey and I am a 10-year post-op of gastric bypass who has lost 256 pounds. I have also recently written a book talking all about my journey through weight loss surgery. It's a little tiny one, so it's great for the plane, for the beach, to just check it out and learn some great tips and tricks and hear my journey about weight loss surgery. So anyway, let's jump right into this topic. Babies after weight loss surgery. Can you have one? Yes. One of the main reasons that I had weight loss surgery was to become a mom. I had had several miscarriages prior and there was nothing wrong with me. We tested everything from my eggs to my uterus, everything. Everything checked out fine except my weight. So the way that it was explained to me, which was horrifying after I had had a very, very traumatic miscarriage, was that basically my body was crushing my uterus. Whether or not that's the case, I don't know. But I can tell you that going through that pain was just not something I was willing to do again. And my deepest desire in life was to be a mama. So I had weight loss surgery. I maintained my weight for about 4 years before I decided to have a baby. And when I did have my son, I had a pretty typical tough pregnancy. As far as typical tough, what does that mean? Well, I had morning sickness the whole time, not just the first trimester. I had a lot of kind of mild complications as well, stemming from the morning sickness. Like I was throwing up all the time, so I couldn't keep a lot of food down. So we did this whole myriad of trying all this new stuff. Plus I was high risk because of my previous miscarriages, because of my age, and because of my weight loss surgery. I was monitored very closely. And so this brought in a lot of anxiety and whatnot. However, 9 months later, I had a perfect, beautiful, healthy little boy who is about, this makes me a little bit teary actually, who is about to be 7 this summer. And he is the greatest joy that I've had in my life. And he is the reason why I had weight loss surgery. So every day that things are tough, or I find a new food that I can't tolerate, or I remember the days of being able to eat whatever I wanted, I think, and I look at the little dude, or I hear him ask, "Mama, can I do this?" or whatever, and it's all worth it. So, getting pregnant after weight loss surgery. Doctors advise that we wait at least 1 year after weight loss surgery before we get pregnant. Why is that? It's because your body is healing. You're gonna go through such shock after weight loss surgery and drop weight so quickly, kind of without you doing anything about it, that it's really, really important that we actually make sure our bodies are fully healed before we bring a pregnancy. Because if you've already had a baby, or if you haven't, let me tell you, pregnancy runs like ravage through your body. Everything changes. Your sense of smell, your eyesight, your hair, your skin, the way you sleep, what kind of foods you like, how you feel, everything. So it's best to make sure that you're healed. Also, to have a successful pregnancy, there's a lot of things like baby will take everything from what you eat that it needs. Meaning, if you're not eating enough, baby may not get enough too. I'm gonna get into why you don't need to eat for 2 in a second, but just bear with me. In the beginning, you're on liquids, you're on full liquids, you're on soft foods, you're just not eating enough to even sustain your own body, which is why you're having such drastic weight loss. It's not a good time or a healthy time to have babies. Now, if you're brand new out of weight loss surgery and you're pregnant right now, do not freak out. There have been several women that I know personally who have had babies in the first few months or have gotten pregnant in the first few months after weight loss surgery and went on to have completely healthy, normal babies, okay? It has, however, ruined their honeymoon period for their weight loss surgery. So you wanna make sure you really maximize that time after weight loss surgery to get that weight off, do everything you need to do for your body, and create this perfect vehicle for a pregnancy. Second thing is, make sure that you have some sort of birth control on deck after weight loss surgery. Some people say that the pill does not work afterwards. It worked fine for me. But there are a lot of other options that you can go into. You can have an IUD, you can use condoms, whatever you're comfortable with. Just have a plan in mind for birth control, at least for the first year. If you would prefer abstinence, by all means, that's fine as well. I find that the pill worked really well for me. I do a mini pill, which means it has no estrogen. It's progesterone only. I find that after weight loss surgery, I was very sensitive to medications, but also my periods were really, really irregular. This helped to completely regulate everything, so I was able to really track and see where I was at. So that's a good option as well. So let's talk about now that you're pregnant. You got those 2 little blue lines or pink lines or whatever they are, or maybe you use one of those digital tests now, which are pretty cool. The first myth that I wanted to spell right now is that you do not have to eat for 2, okay? So you've had weight loss surgery, you've lost all this weight, you're on this great diet, you know what you need to eat, keep doing what you know is right. There are a lot of times in my pregnancy where my doctor would tell me, you need to eat more bread. You need to eat something to fill up your stomach so you stop having the acid, so you stop throwing up. And I said, but sir, I've had weight loss surgery. I can't eat bread. Okay, well, soak it in some milk so it doesn't hurt your stomach. There are so many things I did wrong in my pregnancy, and it resulted in a 90-pound gain for a 7.1-pound baby. Not my finest hour. And I'll tell you right now, it took me 4 years to lose the baby weight afterwards. So take it from someone who has been there, done that. Don't do that. Keep on the straight and narrow. Make sure you're getting in enough protein. Supplement with protein shakes if you need to. I think if I would have had Inspire protein shakes when I was pregnant, I probably would have had a very, very minimal gain, because I get full of them, they taste great, and they're really fueling my body, which is what you need. You're gonna be tired a lot, and so your body is naturally gonna say, hey, feed me sugar and carbs, but that's just a quick fix. The protein and the good carbs from veggies or beans, those kind of things are really gonna sustain you through the day and help to rebuild your energy levels. Plus, it's gonna really give you a nutritious, healthy store for that baby to pull from when it needs minerals and nutrients as well. So that's awesome. I will say in the 3rd trimester, it is generally recommended for weight loss surgery patients to add in about 300 extra calories. So that can come from things like lean meats and vegetables, protein shakes. You can even add in some carbs if need be, maybe a wrap or some high fiber noodles or something like that. I recommend staying away from the carbs, but I do recommend adding in those extra calories. You can get them from fruits, from yogurts, those kind of things are really, really good for you. You also want to make sure that you're having enough water. I was dehydrated 3 times when I was pregnant. And let me tell you, it is the scariest feeling in the world to be dehydrated in the first place, because you literally feel like you're dying. When you're pregnant, it's even worse because you feel like you're having contractions. And if you're only a few months along, that's a really, really scary feeling. So make sure you're drinking enough water. I recommend 75 ounces plus a day. The general recommendations are 60. Try to get over 75. I drink about 100 ounces of water a day now, and I'm not pregnant, but it feels good. My body feels great. Water is also going to help with cravings. We talk about pregnancy cravings a lot. We talk about pregnancy cravings a lot, but what it comes down to is mind over matter. I had a lot of pregnancy cravings. A lot of it was for stuff I couldn't eat anyway, so it wasn't a big deal. However, think about it this way. If you give in now, you're creating bad habits for later. And later, when you're exhausted, you have this new baby, whether you're nursing or not, and you're tired and your body is just ready to just give up. All it can do is produce milk and care for this tiny little human. Is not the time to be going on a crash diet. So keep everything reined in right now, and you're not gonna have that problem later, trust me. So as far as cravings, I did a lot of ginger tea, which also helped settle my stomach when I did have the morning sickness, or the all day, all the time sickness, as I called it. Ginger tea is like a miracle. There are also a lot of like ginger hard candies that are sugar-free that you can use, which are also really gonna help to kind of take away the cravings, but also to help kind of minimize that nausea or that upset stomach feeling. If you get a lot of heartburn, see your doctor right away, because for people who have had weight loss surgery, heartburn can be really, really dangerous, as well as acid reflux, which I know a lot of people suffer from prior. And if you've had sleeve, it may not have completely gotten rid of that. So the doctor can give you stuff for that, as well as for nausea. I was on a prescription nausea medication for my entire pregnancy. It's completely safe and easy to take. It dissolves under your tongue. So talk to your doctor if that's something you need as well. Number 2 thing besides water that is an absolute must are your vitamins. If you take the bariatric eating vitamins, which I have linked down below, the 3+3, they are completely perfect for pregnancy. I will say add in an extra folic acid. Folic acid helps to develop baby's brain. So you need a little bit extra than what comes in the vitamins, so you can take that. If you do decide to take a prenatal vitamin, do some research and make sure it's not full of fillers or any crappy stuff, because you need a good vitamin for pregnancy. All right, so you've had weight loss surgery, you're pregnant, your pants don't fit. What do? Get yourself some maternity pants. Guys, I know this sounds like when you were growing up and your mom had the maternity pants and they looked ridiculous and they're terrible looking, but trust me, the day that I put on maternity jeans, I will remember for the rest of my life, because I remember going like, why didn't I do this 3 months ago? Like my stomach hurt, everything was rubbing against my stomach, which was extremely sensitive, and I had all this extra skin and I was like, I don't know what to do. Do I buy bigger Spanx? Do I wear tights? Like what's going on? Maternity jeans completely fixed everything. It fit my body where my body was completely normal still, and it had this beautiful band in the front, so my stomach and my extra skin were supported but also snug, and it was soft. So get yourself a good pair of maternity jeans. I shopped at Motherhood and Old Navy for the majority of my maternity clothing. The reason being is because I was living in Japan at the time and I had no idea where to buy maternity clothes. Old Navy was really cheap. Motherhood was a little bit better quality. So I think I got 2 pairs of Motherhood jeans, and then the rest of the stuff was from Old Navy, except I bought 1 set. It was a maternity set. So it came with 2 pairs of yoga pants, 2 short sleeve t-shirts, and 2 long sleeve t-shirts. The shirts were ruched on the side, so they hung lower, so they completely covered your belly, but they were also really well cut and well designed, so they fit nicely up top as well. I literally, my son, like I said, is about to be 7, so I was buying these clothes 8 years ago, almost 9, and I still wear them to this day. So that means they were really, really well made clothes. So, and they come in basic colors. I think the t-shirts come in black and white, or you can choose all black. The yoga pants are all black. It also comes with a Bella band, which is really, really good to help really support your stomach and keep everything kind of smooth but snug, because that's what you really, really want. All right, so you're about 8 months pregnant now, and you're like, oh my gosh, can I nurse after weight loss surgery? Absolutely. Again, nursing makes you so hungry. I felt like I could eat my own arm. So what I would recommend for nursing after weight loss surgery is keep a protein shake, protein bars, or other high protein snacks next to the chair or wherever you nurse. That way, if you need something, because usually hunger strikes right when your letdown happens of your milk. So baby will be latched, nursing, and then all of a sudden you're like, I am starving. And then that's when baby is getting the best milk. So baby is just drinking. And it became this tug of war with me and my son. Like, would he finish first? Because I need to eat. These days now we have Grubhub, so I could have probably ordered something, but you want to keep with this healthy track that you've already been on, right? So you don't want to be ordering in stuff like French fries or, fried foods or anything like that. So keeping protein shakes, ready to drink proteins, your water, and high protein snacks or fruits and veggies next to your chair while you nurse is, trust me, it's a game changer. I also found almonds and peanuts really helped while I was nursing. It helps satiate and make me full. Just be careful on portion control because like I said, any weight gain that you happen while you're pregnant or while you're nursing, yes, it is going to come off naturally, some of it, but if you go into excess, which generally people who have had weight loss surgery sort of have a problem with differentiating between excess and moderate, it can get out of control really fast. And I know it did for me, so I just want to give you the warning, just keep your portions in control. What I would do is buy portion packed almonds, like the little 100-calorie almond packs from Costco, and keep those by my nursing chair. I also would keep some in the bedroom, wherever I would nurse. We co-slept, my son and I, so I would keep stuff beside the bed as well because I would get really, really hungry. Also make sure, like I've said 1,000 times, keep your water with you too because nothing makes you more thirsty than feeding a baby. Seriously. Another thing that you can use that is completely safe for us is mother's milk tea. I'm not sponsored. This is, they didn't pay me to say this, but I bought that stuff by the caseload. Because I had weight loss surgery, I couldn't actually eat enough to produce a good, healthy milk supply. My lactation consultant, my doctor, and the midwife all said likely my milk was having a hard time because of that. As soon as I started drinking the mother's milk tea 2 to 3 times a day, my milk supply tripled. And I was able to completely and solely nurse my son without any addition of formula, which was a really, really nice feeling for me. That being said, you don't have to nurse. Absolutely, it is totally a choice. Formula is completely safe and fine. It's totally up to you. But if you do decide to nurse after you've had weight loss surgery, you are going to be super hungry. Everyone's going to be hungry when they nurse, whether you've had weight loss surgery or not. But for you, you need to be mindful of what you're eating. Make sure it's fuel and not just fun, and keep your protein levels really, really high. Something else that was mentioned to me, and it may be mentioned to you, is that having a natural birth after weight loss surgery can be an issue depending on your weight loss surgery procedure. I had gastric bypass laparoscopically, and they were concerned that the pushing would rupture my stitches. Now, this was, again, 7 years ago, and I was living overseas in Japan. I do believe now, after research, that this is a myth. I've met tons of women who have had natural, normal births after weight loss surgery. So just be mindful when people are giving you information. If it sounds a little bit weird, ask for a second opinion, do your own research. Be careful of Dr. Google because Dr. Google is terrifying when you're pregnant, but it's definitely something that you can research and fact check on your own as well. All right, you guys, so those are my tips for having a healthy, wonderful pregnancy after weight loss surgery. To all you new mamas out there or mamas to be who are watching, congratulations. I am getting goosebumps. This is one of the most beautiful, magical times of your life. Don't let anybody spoil it. Be mindful of what you're eating. Try to move your body as much as possible. Vitamins, water, protein. You're gonna do great. Again, congratulations. And thank you for joining me with Bariatric Beauty and Finishing School. My name's Kelsey, and I'll see you guys again soon.